Well, welcome everyone. I know a few of you are still joining and getting online. This is our last session of the Implementing a Self-Measured Blood Pressure Program in the Clinic Setting Collaborative. And today we're going to cover the tools and resources. So it's kind of a wrap-up session, but we also want to make sure that we go over, the different tools and resources. Some of them we've already talked about, some of them may be new to you. And we just want to make sure you have everything you need to put your SMBP program in place and to be successful at that. My name is Jerry Henniker. I will be your presenter today, and I am joined by my colleagues, Andrea Boucher and Carrie Finley. Our objectives are today, we're going to outline our ongoing data tracking recommendations. So we'll have a few slides talking about that, the data that we feel you should collect and keep track of, and then some different national and state data collection that is out there that you also may want to participate in. And then we're also going to review the resources that are available. So some of these are patient-facing resources, and then some of these are resources for your staff. But before we get started, let's start with a polling question. So Carrie, if you could bring up that polling question. And the polling question is, as you identify new hypertensive patients, are you more likely to see your hypertension prevalence rate increase or decrease? So the whole SMBP program has been about working with patients with hypertension to control their hypertension, but you're also going to be identifying those patients. So far we're seeing increase. We'll give it just a couple minutes here for people to answer. Not a couple minutes, maybe a minute to let people answer. I think that's, if you want to share the results, Carrie. So those of you who answered, you got it right. You are correct. As you are identifying patients, you're going to see your rate, your hypertension prevalence rate go up. And we'll talk more about this as we get into our slides for today. I apologize. I'm a little dull. There we go. Getting these slides to move today here. They're a little slow. Also, as we've done in previous sessions, we want to start out with a round robin so we can check in with everyone, see how you were able to incorporate some of the activities from our last session in May into what you have been able to do over the last month. And so our last session was on motivational interviewing. So you can either unmute yourself or you can put it in chat too. It's easier. It'd be nice to have a discussion. So if you want to take yourself off mute, that would be the preference. But if you could please share one or two open-ended or probing questions or phrases that you practiced in your conversations over the past month. And then the other activity from our action plan of last month was, what were some common patient barriers you encountered with your patients regarding SMBP? So that could be actually over the last month or maybe previously too, you had encountered some. So anyone want to take a go at one or two or both of those questions? Not know, Carrie, if we have anything in chat.
This is Sheena. I'm not going to be on camera because I'm eating right now. Sorry.
Oh, it's fine, Sheena. No problem.
And again, I do the build for Epic, so I am not like in front of patients at all anymore. But even when I was in the rooming staff, ask the question, like, have you been able to take your blood pressure? If so, what are the readings? If so, why not? Those are some of the questions that I asked them before, and I know that some of the nursing staff are doing that. We hear that in some of our hypertension meetings, and then just asking them pointedly, like, are you having issues taking your blood pressure at home? Because they're handing them kind of like a little how to take your blood pressure tip sheet on there, like, are you able to get in a quiet room, that sort of thing. So kind of what we have.
So kind of that open-ended, what are the issues they're encountering? And, those are great questions to ask. Did you, and I promised this one over my head when we were talking, what were some of did the patients express any barriers that they were having? As you said, were they able to get in a quiet room? I was just wondering if the patients shared that, or.
I don't think so, that they really had barriers. I think some of them always think they have to come in for a blood pressure check, not that they can use their own equipment. And then some of it's probably the barriers, the consistency. Like, are you taking it as often as we want you to? Like, I think the sheet is 5 times in a 7-day time period, or versus, when are you taking your blood pressures? Are you taking them at the same time? Because blood pressures are going to be different. Is it before meds, that sort of thing? So I think some of the barriers that we've had is just patients understanding, not when I say everything that we need, because it seems like we're kind of demanding that way, but they're like, oh, well, I feel like I missed some steps. So I didn't write the numbers down. Or the barrier is they're too afraid to give us their number because it's still high and they don't want to give us their number.
Yeah, they feel like they did something wrong. Yeah, no, those are good points. Others have any open-ended questions or phrases that they've been using, or any barriers also from their patients?
This is Stacy. I haven't been face-to-face with patients either, but I've been coaching our nurses on their interactions with patients. And one of the things that we've kind of shared with them is to potentially start a conversation and ask the patient, how do you feel your hypertension is managed? And then they can guide their educational opportunities based on that, because we've ran into it where some people think theirs is great, even though our records show that it's not. So that's kind of how we've implored them to start the conversation, and then kind of let that flow into some natural education opportunities.
Yeah, I was going to say that's a great question to start with, how you think it's going. And if they, like you said, if they think it's great, kind of that follow-up. So why do you think your blood pressure is great, even when you're saying it's not? So it kind of does lead into those conversations. Thanks, Stacy. Anyone else have anything to share? And I just want to make sure, did I miss anything in chat? Carrie or Andrea?
Nope, it looks like we're good from the chat perspective.
Well, if you guys think of anything too as we move forward that you want to share and put in chat, that's perfectly fine too. So now we're going to start with data expectations. So as part of our presentation today, but before I even get started with that, I was wondering, does anybody want to share what data they're already tracking for their SMB program? So what it is that you've already put in place that you're tracking. And if you're not tracking anything, maybe what you're planning to track, what you've learned from these sessions. Again, if you just want to take yourself off mute, that'd be great. Or if you want to put it in chat too, but we're a small enough group. If you want to just come off mute, that's great. Any data that anybody's tracking or planning to track? There's no wrong answer. Well, we can move ahead and we'll talk about what some of the data that we're thinking, are good things to track for your SMBP program. So what we're recommending is that you track the number of patients that you do have enrolled in your SMBP program. So who it is that you all have in your program. Then, as we kind of alluded to with the polling question, your hypertension prevalence rate. So for the numerator for this, it's going to be all of your adult patients, age 18 to 85 is what we're, kind of putting for that age range there, who have been diagnosed with hypertension. And then the denominator would be your total adult patient population. And again, to make sure that matches up, you're going to be 18 to 85 for the age group. Sorry, we didn't put that on the slide. I just realized. So that'd be one thing that will give you your hypertension prevalence rate. And as we said, the more patients you identify, you're gonna increase with that prevalence rate. Excuse me for my voice here. And then another thing you might want to, or you probably want to track is your control of high blood pressure. So, and we just listed again, this is NQF 18 and ECQM 165. So for here, it's going to be your numerator. It's going to be your adult patients, again, 18 to 85, who have that diagnosis of hypertension and whose blood pressure is adequately controlled. And we're using the numbers 140 over 90 here or below would be those who are adequately controlled. Your denominator, then again, you're going to want that to match up with your numerator. So again, it's going to be your adult population, 18 to 85, again, who have been diagnosed with hypertension. So that's what you're going to want to take a look at. The one thing to be aware of as you're, identifying more patients, of course, your prevalence is going to go up. You also may see the second bullet point, the control of high blood pressure. You might see that rate actually go down because as patients are identified with high blood pressure, those newly identified patients, they're probably not in control. So don't be discouraged if you're seeing your control rate go down as you're identifying more patients. And we recommend that you review this data at least quarterly. Next slide. Oops. So as I kind of alluded to already, what to expect. Your hypertension prevalence rate is going to go up as you identify more hypertensive patients. Over time, as I was just saying, you might see your control rate actually decrease as you start out, but over time it should increase because those patients who were previously uncontrolled and were, showing up in your numerators are going to be in better control. They're going to have better medication control, or maybe they did it through lifestyle. So over time, your control rate should increase, but don't be, as I said, don't be discouraged if you see it decreasing at the start. And here we've got a few of the data reporting mechanisms or avenues at both the national and there's some here too at the state level. First is the merit-based incentive payment system, or MIPS. And there's two different MIPS measures that you might already report to or want to report to. One is the MIPS 236, which is, of course, the control of high blood pressure. But I also added here the screening for high blood pressure. So we want to identify those patients who maybe haven't been diagnosed with hypertension yet, because sometimes many times they're at more risk for complications because they aren't treating their hypertension. So again, that's MIPS 317. There's also a couple MIPS measures that you might want to report to that are part of, that you can use in helping to manage your hypertensive patients. One is the engagement with your quality innovative network or quality improvement organizations. They're the QIOs in every state, and actually Superior Health Quality Alliance is that. And what you can report there is to the implementation of a self-management training program. So SMBP program would be something that you could report on, that you have in place, and that's a medium weighted improvement activity within MIPS. There's also the use of your electronic health record, or EHR, to capture patient reported outcomes. That's another medium weighted improvement activity within MIPS. And then we'll make sure we're putting together a resource page. There's a number of links in this presentation today. So we'll be putting together a resource page with all these different links that you can go to, and that will be uploaded on Connect after the session today. For those of you in Minnesota, there's also Minnesota Community Measurement, and controlling high blood pressure is part of the Minnesota Community Measurement V4 or the vascular health score. And we've got the Minnesota Community Measurement link included here. So next we're going to talk about all the different resources that are available to you. Some of these we've probably, like I said, discussed in previous sessions, but some of them might be new to you today. And I'm going to actually try to show you some of these. So hopefully I'm not going to lose too much oh, I can't say the word. Actually, hopefully I won't lose my connection as I'm trying to click on some of these links and bring them up so that we can actually look at them. So the first one we have here is EMAs. It's their 7-step SMB quick guide. I'm just going to click on the link here so you can take a look at it. There, good. So the thing that's nice about this program too, it goes through the different steps, and, we've covered all of this, as we've talked about the program during these 6 sections, but this is kind of one, quick source you can refer to. They also have a number of links within this document. So I'm going to just click, it's the blood pressure validation device listing, because their second point is to confirm that the device validation and cuff size. So if you click on this link, it brings you to this website that shows you the different device validation listing. So that's a nice resource there. Then they also have cuff selection is another resource. And so I'm just going to show you some of these. You can click on these, bring you right to the resource, and it's right all within the one document. And as you can see here, they go through the different, as I said, they have 7 steps. So, they talk about training the patients, and then they've got a training video here, and they've got that also in a Spanish version along with an infographic. I'm going to just click on that quick. And this is one I'm pretty sure we had shared earlier in one of our sessions, but just a nice kind of print off you can make too that might be helpful to share with patients, so that, when they're taking their blood pressure at home, they remember to follow all the positioning steps. So, and then they also have that in a Spanish version. They have a recording log available that you can use, or that you can print off for the patients, where they can record their pressure. I think you're saying that, Stacy. Yeah, they maybe don't want to share their blood pressures with you because they didn't, it wasn't perfect. So they didn't want to share it. But this is, something they can use at home to record their blood pressures on. They've got the SMBP averaging tool for averaging the blood pressures, also the interpretation tables. And then another nice little tool they have in here is the codes for SMBP, so that you can use when so you can code properly when you're doing the SMBP program in your session. So that is that tool. And now I'm going to cross my fingers that I can get back to our presentation here. Is everybody seeing my slides? Yay.
Yes.
And so this was just the words. So this is just what we kind of went through on this next slide here. So we've talked about these. Some more SMBP tools. We have the loaner agreement and loaner device tracking tools. Million Hertz has a number of, if you go to the Million Hertz SMBP section, they have a number of tools. I did want to show you though too from Target BP. That's where these tools came from. So they have a bunch of nice tools on their sites. And then this is just the loaner device agreement. But if you go to the downloads, there, load it quickly. Are you guys seeing all this? I'm hoping as I'm sharing my screen.
Yes, Jerry, looks good.
Okay, just wanted to make sure. And so they've also got the BP positioning. They've got, some quick start guides. There's a number of different things through Target BP. So that's why I wanted to show you. They've got the technique guide. They've also got the US blood pressure validated device listings. So if you go to their site, there's a number of different things that you can look at there. So, and hopefully you're seeing my slides again.
Yep, we can see them.
Okay, and then here's more of the SMBP tools. So we talked a little bit, I just showed you a number of these on the target BP, the patient training checklist, device accuracy tests. They've got some staff competency testing, and then research articles that are listed on the SMBP site. So just, so like I said, the Million Hearts and AMA, and then Target BP have a number of wonderful resources that you can access. Here's the blood pressure cuff selection. And I want to say this one actually, I'll pull this up. This is from AMA too. And I guess I didn't need to click on that because it's the exact same thing. But so that is from AMA, but it also goes through, you know, measuring to make sure your patients have the right size cuff and how to do that. And here's an article that is from Topline, and they, what they found is they note that even though there's strong, and we've got the link to the article so you can read the whole thing, but there's strong scientific evidence that shows that self-measured blood pressure programs, and two, when you have that clinical support from your staff, they really help people control their hypertension. And so there's a lot of evidence that supports that. Also, national guidelines recommend SMBP for treatment and the management of hypertension. And it's a great alternative for people coming into ambulatory clinics. I think we talked about that a little earlier today about, you know, people thinking they need to come in to have their blood pressure done when they can really do it at home as long as they're keeping track. So really, there's been a lot of recommendations for SMBP programs, but despite all this evidence, and national, you know, healthcare leaders have endorsed SMBP programs, the uptake of SMBP in the United States still is fairly low. And part of that is, you know, there's problems with the third party payer, the reimbursement. That's one of the barriers, or at least it's cited as a barrier. I think that the reimbursement is getting better, but I think that's still maybe why we're not seeing as much of that, or as a great uptake of the SMBP programs. And so I think as we see more and more, and especially what we saw with COVID, you know, more of this in-home with telehealth, but doing the SMB programs at home, I'm hoping that we're going to see more take of SMBP and more people using it, and it not those barriers of, you know, third-party payer payments and that in the future. And this is from another thing I just wanted to share is there were a number, you know, Million Hearts developed a toolkit actually for COVID-19 and cardiovascular disease toolkit during, you know, at the height of COVID. And so this is linked here, but it talks not only about SMBP, but, you know, encouraging how you can keep your blood pressure under control and how to control your cardiovascular disease during COVID, because again, people weren't able to go into their doctors as often. There was more use of telehealth. And so they developed this toolkit, which is something that we can still use because, you know, people, I think, you know, not everybody can come into the doctor's office as often. So just wanted to let you know, these were more COVID-19 focused resources that were developed by Million Hearts. Another great program is Release the Pressure. And I'm not sure if is anyone familiar with Release the Pressure? I'm just wondering if anybody on the call today is participated in that or shared that with their patients. The Release the Pressure campaign, it brings together, it's really a diverse coalition of healthcare organizations, and they call it the Release the Pressure Heart Health Squad. And the organizations are dedicated to partnering with the Black community to improve their heart health. Really, the real focus is really with Black women, and they want them to take preventive action to protect their heart health, and be part of this movement of controlling their high blood pressure. because high blood pressure, as we know, is the leading risk factor for heart attack and stroke. And what the pledge says is they have you set a blood pressure goal with your healthcare professional. You're going to monitor your blood pressure at home is the second point of the pledge. Then activate your wellness plan. So you put together a wellness plan and activating that, and that you're checking in with your squad regularly. So it's another program if you're not already participating in that you might want to check out. And this is the Million Hearts Blood Pressure Protocol. These are evidence-based strategies that can aid in hypertension control. And I'm just going to click on the link and show it to you here quick. Looks a lot like what we see there, but it's a nice little booklet and toolkit that you can use. And again, we've seen it, actually, we kind of saw EMA had something kind of similar. So it's just an action guide that you can, print off if it's easier or pull up. It's actions to improve your delivery system design. These are strategies for hypertension control. So it goes through a number of different steps here. And then also actions to improve your medication and adherence for your patients, and how you can optimize patient reminders and supports. And then it lists a number of different resources. So another wonderful resource. Okay, not that I have favorite tools, but I really like this tool. It's from the CDC, or Centers of Disease Control and Prevention. And this is actually a tool. It's a flow chart, and it's for managing both your stage 1 and stage 2 hypertension patients. And it talks about, it's about the thresholds that you should have in place for both systolic and diastolic, follow-up time periods, medications, and prompts. I'm just going to pull it up here because if you haven't seen it before. So this is something that you can fill in specifically for your clinic. So you can put your clinic's name up here. Anything that's in the red italics, you can change. So then you can make it for your patient, specific for your patient. So what medications that they might be using or need. So that's what this little flow chart is. So again, you can make it specific, and that does go through the instructions on how to use the template. So, and of course the link is here too, so you can use that. Here we have linked, it's a publication from the National Association of Community Health Centers, and it asks the question, are community health center patients interested in self-measured blood pressure, and can they do it? And so the gist of the article was that they did a pre-questionnaire. It was completed by 478 patients. And then the post-questionnaire was completed by 372. So these were patients in the self-measured blood pressure program. 77% of the patients who responded to both the pre and post knew what their ideal blood pressure was. And they also felt that, they benefited from the engagement in a self-measured blood pressure program. And in addition, the patients did see a decrease in their blood pressure by participating. I think it was statistically significant anyway. And like I said, 85% of the respondents said that they had a positive experience with SMBP. So basically what they're saying, if you have an SMBP program, your staff is trained properly, and then the patients are trained properly. It's really, you can motivate patients to do their blood pressures at home and then to see that decrease in their blood pressure or have their blood pressure better controlled. This slide, we're just looking at some of the different, we've talked about, again, lifestyle changes, just kind of a nice little slide you can print off if you want, changes that can help manage your high blood pressure. So, we talk about medication and monitoring your blood pressure, but there are other things you can do. It's like increasing your physical activity. And again, I think it's a reminder to the patient sometimes, a lot of people are all or nothing. So they're thinking, I have to go out and run a mile to control my blood pressure. And it's really just making sure you're going out and walking. And it might be just walking up and down the driveway every hour or something. It's increasing that activity level, reducing your sodium intake. Again, starting simple, you know, like not adding salt to your food. Of course, we want them to keep track of the foods they're eating too as they get further into the program. But, you know, start simple, like I said, with, you know, maybe it's just making sure you're not putting salt on your food. Reducing alcohol consumption. Alcohol, again, it can temporarily increase your blood pressure, partially because of the calories in alcohol, but also because of some of the physiological effects that alcohol has on your body. But over time, that long-term consumption of alcohol can be very damaging, not only to your blood vessels, but to your digestive tract and your vascular system and your liver. And this is what leads to the high blood pressure. So what studies have found is that heavy drinkers who cut back to just even moderate drinking, so we're not saying, again, that they have to totally eliminate alcohol, but just by cutting back, their systolic blood pressure could be decreased by 2 to 4 points, and their diastolic by 1 to 2. So other things, of course, are healthy eating, eating fruits and vegetables, and then sticking more with like low-fat dairy or lean meats really helps with blood pressure control. And then losing weight. And again, it's not like, you know, we're asking people to, you don't have to lose 100 pounds overnight. You know, I think they always say start out with 10% of your body weight, and every 10%, you know, you're going to see a reduction in your blood pressure. And here we have listed for each state the YMCAs that in the blood pressure management or blood pressure self-monitoring programs that are available in each of the states. And I think that is all I have. Any questions? Do we have questions in chat?
We don't have any questions in chat right now. We had a few comments throughout your presentation. One of them, I think it was like the very first handout you shared. Chena commented that they use that one with their patients. So that's pretty cool that one's already in use.
Great. I'm just wondering too, from the participants, of some of these resources, like I said, I think some we've maybe shared on previous, or like maybe you're familiar with them. Do you think these are the resources that we're sharing today are things that you'll look into sharing? Did you find them helpful?
I found them helpful. This is Chena again. It's nice that there's consistency. So like the same ones that you are sharing are the same ones that we're also implementing and providing with our patients. So if patients aren't necessarily ours, or maybe they share with another entity, you know, we at least know somebody else is sharing the same resources we're sharing. So patients maybe aren't getting the same message, so patients are getting the same message instead of inconsistent messages. So that's good. I know that our blood pressure guidelines for just our regular registry are slightly different. So I have the access to the Minnesota Community Measure slides, and I was going to the IVD because we don't use the vascular care one. We don't use vascular care. We just have the blood pressure with IVD and diabetes, but the measures are a little different. So we allow some of the older patients to have a higher blood pressure reading than that 140/90. I think it's 150/90. But otherwise, I mean, it's good that there's consistency out there.
And you do bring a good point. I know there's been conversations about that, you know, for some of the blood pressures when your patients are older, and, you know, what is best for them. I mean, bringing them down to 140/90, is that what's best? Or is it, if they're doing okay at like 150/90, you know, is it okay to leave them at 150? But you're right, sometimes that throws off whether they're a controlled patient or not when you're doing measures like for MIPS or Minnesota Community Measurement. It does kind of throw your off. So I know everybody was trying to get on the same page with the numbers, but yeah.
Oh, it's kind of funny because we don't, so let me just pull up our registry. So I give you the right age, not that it matters, but so our 18 to 59 is less than 140/90, and 60 to 85 is less than 150/90, which is what I think it was. But so our diabetic patients don't have that same threshold. Our diabetic patients are 140/90 regardless of their age. So it's hard for our end users they're like, hey, this person is they shouldn't be in the denominator. And I'm like, no, they should be in the denominator because they have their blood pressure's too high. And they're like, oh, this is so confusing. And I'm like, it is and isn't all in one. Just get the person's blood pressure down. It's just like, the tobacco use, just don't smoke kind of thing. It's easier said than done. Or I shouldn't say can't smoke anymore. It's just don't use tobacco. Because again, we have to remind our end users, it's smokeless tobacco counts against people too, not just the smoking tobacco. So.
And you bring up a good point too, and that goes the same with blood pressure, that it's not just smoking, it's the smokeless tobaccos, they have nicotine and everything in them too. So those are going to affect the blood pressure too. Because I think, sometimes patients maybe don't even realize it or think of it that way. I think we've thought of the smoking all the time versus all the different forms of tobacco out there. So any other questions and to Carrie, Andrea, anything that, any comments or anything that you want to share from past sessions, since we're kind of wrapping up today, that we want to make sure people are aware of?
Yeah, I don't think I have anything else to add today.
Yeah, I agree. I don't think so. I'll make sure to post this recording on Connect after the session once it's available. But other than that, I don't think I have any additional feedback to share.
And that's a great point, Carrie, because all of the sessions are the recordings, and then any of the resources and we'll be listing all the resources. We pulled all the links from today, and they'll be on a resource page on Connect for your group. I do have just a few other slides here. Our stand, if you're not already on, I'm guessing everybody on the call today is already on Connect, but if not, you can continue. So this group will still be on Connect, correct, Carrie? People will be able to, talk to each other about this work, even though this is the last session. So again, you'll have access to all the tools. They're out there on Connect, and you can, talk with, your cohort, people within your cohort from the previous session about maybe some of the things you're trying. Maybe you're trying something with motivational interviewing and you want to ask questions about, or you've used one of the tools and you have a question about, how that tool works. Feel free to, continue your conversations on Connect. We also wanted you to be aware of, in addition to this collaborative, we have a webinar series called Back to Basics, and that happens every month. It's the third Tuesday of every month, and it's at 12. It's from 12 to 1 Central Time, and then again from 3:30 to 4:30 Central Time. So, oops, I'm not sure what I did. Sorry about that, guys. But these are the upcoming sessions that we have. And so things that you might be interested in, feel free to register. They're on, I know that you can go to Connect for these too and register for these sessions. We also have available, and these are also, see, I'm just making you go to Connect all the time here, but these links are active too. But these are documentation and coding guides. So I did show you the one coding guide that was available, the CPT coding guide on hypertension. I think that was through AMA. But we've at Superior Health developed coding guides for chronic kidney disease, diabetes, hypertension, and tobacco use. So those are available for you to access through Connect, Superior Health Connect. And then, and this will actually be an upcoming session from one of our Back to Basics sessions, but it's the Shine a Light on Stigma. And really, words really matter, especially when we're talking about things such as stigma around substance use disorder. So what we're asking is that people take the pledge. You can click the link to take the pledge. You can take it as an individual or as an organization. And then we've got another link here that talks more about stigma, and you can learn about stigma. And then we ask that you use non-stigmatizing language. And then the fourth part of the pledge is to look at Superior Health Shine a Light on Stigma, their toolkit. And that's linked here too. We want everybody to feel free to join this effort. And if you have any questions about it too, just let us know. And that is all I have. Did I miss anything that I have a hard time seeing chat when I'm presenting? Sorry. So if anything else come up in chat, or if anybody else has any questions before we leave today. If not, this has been very enjoyable for, I'm speaking for Andrea and Carrie, but we loved having you, being with you guys for the last 6 months and going through this SMBP program startup. Hopefully it was valuable for you, and you've been able to take some of what we've been talking about to your clinics or your healthcare setting and be able to put it in place. There isn't anything else. I'll wrap it up for the day, and thank you all for joining us.